Hi, everyone. I'm really glad to start this panel today for the World Hearing Day on hearing health, the new global priority. We got together a very interesting round of stakeholders from the different parts, from the science, from the technology, from the NGO world, to really shed some light on hearing health and how we can raise awareness around hearing loss and how it's affecting our daily lives. How about we start with a quick round of introductions of our backgrounds and our role in the hearing ecosystem. Claire, do you maybe want to start?
Hi, nice to be here and talk about this very important issue. My name is Clare Forshaw. I'm the founder and director of the UK Hearing Conservation Association, set up about 2 years ago to emulate what the USA have in terms of a national hearing conservation association. So really a group of multidisciplinary professionals, ambassadors who want to make an impact on preventable causes of hearing loss.
Thank you. Dr. Reed?
Sure. I'm Nick Reed. I'm an assistant professor in the Department of Epidemiology at Johns Hopkins Bloomberg School of Public Health, but I'm an audiologist by training. My role is really just thinking about studying hearing loss on a population level. And I specifically focus on sort of access to care and different care models, and really also thinking about, what happens when we address hearing loss and, what are the consequences of hearing loss in healthcare settings? This is sort of a personal interest of mine, just thinking about how hearing loss relates to things like delirium or hospital length of stay or communication at that level.
Thank you. Markus?
Hi, my name is Markus Jausovec. I'm the CEO and founder of Everlisten, an Austrian-based startup with the focus on bringing people who suffer from hearing loss together with people who can help. And we are implementing a platform for this reason, and which focuses on the awareness of hearing for even more younger people.
And our very own Sarah.
Hi, everyone. I'm Sarah Voice. I currently lead the research team and operations at Mimi, so definitely a home court advantage here today. But I'm really honored to be in a group of such diverse people attacking a problem that's near and dear to my heart, of course, hearing health and hearing awareness. So it's really exciting to be on a panel with scientists, activists, and technologists trying to solve the problem.
Thank you for the introductions. Maybe we start with a broad question. What's the state of hearing health today? Maybe Claire, with your background, you have the best insights to get us going there.
Well, interestingly, I don't have the best insights because I don't think any of us truly know the scale of the problem we face, if you like. We know those who have a realized kind of significant hearing disability. So we can measure those who have sort of had access to help and support, medical access to help and support for their hearing health status. And that obviously is fairly significant. We know 5% of the population suffer a disabling hearing loss. But that really, I think, only scratches the surface in terms of those who are actually living with an impairment or a detriment to their hearing health, which we're not picking up. And I'm sure we'll talk a lot more about the kind of stigma and the kind of barriers to accessing support for hearing health. And we know that a lot of people with a hearing impact may not access support for up to 10 years. So they would benefit from a hearing aid, and yet they will not, for whatever reason, actually come forward. And it takes people about 10 years before they'll actually admit they have a problem and come forward for that help. So although we have some idea, and obviously we have a huge number of young people with pretty poor listening habits in terms of noise source, and again the scale of that impact is having, because I don't know about elsewhere, but in the UK we don't have a national hearing screening programme, so it's very difficult to know the actual hearing health status of our population at any time.
maybe Sarah, maybe you want to add something on the data that we have?
Sure. Yeah. I mean, I think Claire has it exactly right. It's extremely difficult to estimate, but even by the most conservative estimates, it's a really shockingly large problem. One of the areas that we're most concerned about is, as you already mentioned, the young people who are at risk. And I think the conservative estimate we saw that more than 1 billion young people, 12 to 35 years of age, are at risk for hearing loss due to recreational exposure. And that's something that is just really, really shocking and also preventable. And that's why it's so exciting to be talking about this problem now. It's something we can actually address with technologies that most people have in their back pocket and throw around like it's a toy, but really could be something powerful to help address this issue.
And from the clinical side, like what do we see there? Are there any patterns that are emerging? Nick, do you have like more from the data on your side?
Sure. So specifically, from the clinical side, from a pattern standpoint, I would say that we might look to some of the, there's a paper from the United States using nationally representative data, and it builds off of what Claire and Sarah just said. We have potentially more hearing loss coming in younger adults due to what the noise exposure levels. And this data showed when they looked at pure tone audiometry, the pattern suggesting noise-induced hearing loss. And these levels were not, beyond hearing loss thresholds necessarily, but the pattern was there. And to see that shape in teenagers is quite alarming. This study is now several years old. Unfortunately, it's not a longitudinal cross study. It's only cross-sectional. So we don't, to Claire's point, we don't know a lot about how hearing loss progresses. We've really ignored it for the most part. I'm sort of very proud to say, but also very disappointed that at our lab at Johns Hopkins, at our center, we have an audiology core that focuses on adding hearing measures to epidemiologic studies around the world. And over the past 2 years, we're responsible for over 60,000 hearing measures in those studies. And what that gives us the advantage of is now we know their hearing and we know many other factors about this person: MRIs, cognition, demographic variables, psychologic variables, atherosclerotic variables. We can learn more about risk factors for hearing loss and what hearing loss causes. But that's just scratching the surface. I mean, there are so many other studies that have ignored hearing loss completely. And I'll also make the point to your question about the state of hearing health today. When we talk about hearing loss on a world scale, we often use the World Health Organization disabling hearing loss. And Claire made the point that that isn't necessarily correct. And I think there's a couple of problems here. We've based the idea of disabling hearing loss in the World Health Organization off of pediatric data. We've sort of mitigated our gerontologic population. Older adults were not considered a part of this originally. And we based all of our, measurements and categorization off of this. And so, there's a real misalignment with the way we even think about hearing loss. We've created it as this benign part of aging that we don't necessarily worry about. And instead we focused on children because that's where the research is. But in reality, it's the same hearing loss. The world didn't change. You still have the same problem: communication, voices, all the same. And it's just a different problem, but it's still important. So I think in hearing loss terms, the current state, we also have sort of a discrimination problem of the way we think about it.
You were slightly touching on it on the causes and the exposure. Do we have data on where the majority of the exposure is now coming from?
I have so audiology as a field and hearing loss science has been very siloed, I think, over the years. And now we're seeing these silos break down, where people are implementing public health and epidemiologic methods. We're working with industry to study more. The Apple hearing health study at University of Michigan is a great example of this, right? And I think we've known for a long time about noise. And I think we've known for a long time about factors that interact with noise, like smoking, to make people more susceptible to it. But from a big picture population standpoint, we actually don't know much. There's a lot of data out there, and this is going to make people angry. that I'm going to say this, but there's a lot of data out there where people have fallen back on and said diabetes causes hearing loss, right? And microvasculature changes cause hearing loss. But those studies are often unadjusted for basic principles that could also, and confounders that could cause hearing loss. And so we're making a lot of assumptions off of sort of bad data sometimes. The studies that are well adjusted and well thought out often actually don't find much of an association there. And it more likely has to do with these interactions with noise, which we don't capture in those studies. So yeah, I think that we're still scratching the surface there of even what causes hearing loss, even though that's what we've been studying for 30 years.
Markus and Sarah, you're on the technology side. Like, what role is technology in causing hearing loss? And how can it be part of the solution, like raising awareness or so? How do you see the role of technology there?
Maybe I can start, Sarah. My answer in this topic will not be that data-driven like the beginning statements of all other people in this panel. I was just thinking about the basic activity we do on our platform is to raise awareness of the forgotten sense hearing. So it's even a more emotional point of view from our perspective. And you know, as the forgotten sense, I believe that you can't win the game of awareness of this group not by raising the index finger. I think it's called index finger, and repeating how necessary good hearing is, and don't do this and just do that, because everyone will be fed up with this kind of information. So from my perspective, a good story is not explained by its presentation, so not by the platform itself or something like technology. A good story will become a good story when the listener feels something when he hears the story and he listens to the story. So this feeling depends on the will to listen of the one who receives this information, you know. So I think technology and we all should raise the ability to listen to the world of everyone who will use technology, and from that on, automatically the awareness of the term hearing loss will raise in general. So, but you know, at all this will be a long and rocky road, I guess. But that's just my emotional point of view on technology itself. I don't know if Sarah will bring something into like some good hard facts in that field.
I'm not sure if I have a good hard facts, but I think, you know, all of us working in this sort of public health adjacent field know that the topic of preventative medicine is extremely unsexy, regardless of whether it's preventing hearing loss or, you know, preventing diabetes. People really only tend to take action at the point where they're suffering something acutely. And especially with something like hearing loss, by that time, it's really too late. And so the approach that we kind of take at Mimi is that what brings people together, what's so important about audio and especially music, is this sense of connection and joy. And how can we take this incredibly powerful emotional force and use that for good? So I don't want to make you, you know, I don't know, start eating broccoli so you lose weight, or, you know, the equivalent of that for hearing. I want to still bring joy and connection and the things that people enjoy about audio, and then also give you information about how to protect yourself so that it's something that's basically seamless and unconscious and doesn't become something that becomes a chore or seems overly paternalistic.
You were mentioning that prevention is not really happening in general, but especially for hearing health. I think it is I mean, it's accelerating and getting worse, like the exposure caused hearing loss. Like, why are the governments not seeing that and acting? Or what are the blockers there that you see from your different fields of expertise? Is what's in the way?
I think Claire can probably speak to this better than I can, but I would just say I have been very encouraged to see movement on even the legislation side, like, the World Health Organization taking action to start talking about dosimetry, and instead of boiling hearing protection down to, okay, just don't listen to loud sounds, you start to have a more nuanced conversation about exposure and, in general, how you can meter your noise exposure or your exposure to sounds. And yeah, of course, really interested to hear what Claire thinks.
Yeah, I mean, I've been part of the civil service in the UK before, and we've got the legislation. I've worked with the National Health Service in trying to again promote hearing health amongst other health conditions. It's not, like you say, one of the sexiest topics. There's a lot of stigma associated with hearing still. People are embarrassed of it. People try to hide it and mask it, and that's amongst those suffering from it and those in society. So there's a lot to do to raise the profile. I think the fact that we talk about hearing health and we talk a lot about hearing loss, but there's lots of kind of implicating factors that the relationship of hearing health with other health conditions. We talk a lot now about mental health and stigma around mental health and breaking those barriers down, and yet we don't think of the link between our hearing, our ability to communicate and socially interact, and that all comes down to our sense of hearing, and not having that at full capacity, the impact that has on mental health, social connection, depression, anxiety, and other health conditions. And we know the close link now of hearing loss with earlier onset of dementia. So I think trying to raise awareness of hearing health as important in itself and in linking to other potential to improve health and well-being with good hearing health, I think is something that we need to do. So there's a lot more to do, but obviously you're trying to win the battle against other health conditions who are saying, we're more important. And I've always been on the side of, prevention is better than cure. And if we're going to really make an impact, it's starting with young people, it's starting with education, it's starting with giving people tools. You were talking here a lot about kind of innovation and technology. You give people tools that give them information that they can track their health. You're starting to get somebody engaged in something that they want to win at, they want to be the best at. So I think we need to get policymakers and kind of rule makers, but policies and laws don't always win the game. We tend to do things, I think, which Markus was saying, because it means something to us and we can relate to it. So I think going along that channel is really important as well.
Do you have any special success stories to share? Like what big advances have been made? If we say, okay, this was really a big step forward in the last year or so.
Yeah, I think there's definitely more, as I say, awareness because of the link to other health conditions, unfortunately. So not hearing health itself, but the fact that it has so many kind of confounding implications. But more recently, we started going into schools and working with teenagers just to educate them, because they don't get a lot of public health education, and so they're getting more now again on the mental health side, but going to schools and talking to them about their hearing health, what dangerous sound sounds like, and how they can check that. So we take a hearing dummy and let them listen to what levels they're listening to on their music devices, and tell them how long they've got with that level of noise, and they're like, wow, so they can be engaged if they're given the information. So that's just a small anecdotal pilot of success, and it is those small steps, but trying to elevate that on a much bigger scale. It takes everybody to be talking about it, doesn't it?
It's really great to hear your excitement there. Are there similar success stories on the medical side you could share, Nick?
So it's interesting. I don't actually spend a lot of time in clinic. I'm very much on the public health side where my primary appointment in Epi is. And I think that, yes, there is a greater awareness, though, in the healthcare system in general, where a few years ago, and I'm actually going to not talk about otolaryngology and audiology, where hearing loss is already sort of focused, but gerontology now, at our institution at Johns Hopkins, the Department of Gerontology has invited us to talk more about hearing loss, and they want to know how they can talk to their patients about it and what they can recommend. And I'm going to be honest, this is all under the context, this umbrella of this question you're asking. You know, like I said, audiology and otolaryngology have been gatekeepers for a long time. As we break down those barriers and we get technology companies involved and consumer companies involved and advocacy groups more involved, they're the right messengers. The healthcare system, public health, governments, they're not good messengers. I mean, this is basic behavioral economics. I don't care what a public health person preaching says. I do care when I have a technology company and you can, as Markus sort of alluded to, you can gamify this and you can turn it into something that people actually care about on a personal level, and they learn their own hearing and they become involved with their own health. That's very powerful. And breaking down those barriers and realigning hearing healthcare worldwide, I think that is how we're going to get people involved. And I think that is where we're seeing the real changes start to take place from a prevention standpoint, but also from a hearing device uptake standpoint. You know, we do have some data in the United States that this only came out 2 months ago, showing that there has been an increase among older adults in hearing aid ownership overall. It's not necessarily all good news. There's haves and there's have-nots. Some groups are not seeing the same benefits that other groups are in the United States, but overall there is a real change happening.
Do we know where it's coming from? Like what's the...
So I think it has a lot to do with this this breakdown. So as you know, the same time period where we see the change happening is the same time period where you see in the United States specifically the passage of the Over-the-Counter Hearing Aid Act, which has not been enacted, but it has spurred companies getting involved. You know, Bose has hearing devices. There are other companies putting out hearing devices. The truth is, the most recent Apple AirPods basically could function as hearing aids for the things that they're doing. And they even have internal microphones in the ear canal to look that you could use as like a real ear measure technique. I mean, they're very advanced, and we're starting to focus more on this. And there's multiple apps out there now thinking about customizing your audio output for hearing loss. These are all things that behaviorally are going to nudge people in the direction of caring more about their hearing loss and potentially doing something. And so when we see in longitudinal data over this same time period that people are increasing their uptake, I attribute it to that. Also, you know, to Claire's point, the awareness, you know, when we relate hearing loss to something important and scary like dementia, people might be more inclined to do something. But otherwise, there's very little factors to attribute this to. People are not becoming more wealthy. Hearing devices overall are not becoming cheaper. They're relatively the same. I mean, the consumer devices are much more accessible and less expensive, but there's not much you can really point to in the grand scheme of things that would be changed. Insurance hasn't magically started covering hearing aids in the United States, at least. You know, and the NHS hasn't had in the UK massive changes. I can't speak to the rest of Europe because I don't study it very closely, or the rest of the world, but I don't think there's been any insurance changes to account for that.
I think touching on this technology aspect of it, I mean, Markus and Sarah, what do you see there what do you see the technology companies doing already, or what do you see coming down the line that could accelerate this awareness and the things happening?
Even in the time that I've been working for Mimi, which is the last 4 years, I've just seen a massive shift in how easy it is to talk about the topic. I remember when we would first talk to partners about integrating our technology into consumer devices, it used to take like a solid 15 minutes and, you know, maybe 30 slides to explain what we were doing and why it was important. And, you know, first you have this sort of glazed look on people's face. Why should I care? This is, you know, something that my user's not going to want. And now 3 slides. Oh, okay, I understand what you do. Cool. This is like the thing in the AirPods. This is like the thing in blah, blah, blah. And all of a sudden, you know, I think not to be too self-promotional, but, you know, just today we're announcing partnerships with TPV Philips as a partner. So it's not just these sort of niche products. It's everywhere. It's going to be everywhere in people's home. And I think there's just much, much, much more awareness, and the technology is there. It's ready to be put in these devices. Basically, every device you have that has audio could have this accessibility feature. So I'm very optimistic overall how much I've seen the market change and how much technology firms have become interested in the topic.
Good point, yeah. Markus, do you?
I can't answer this from the same perspective as Sarah, but I just see that some years ago, I think the technology companies did not do enough. Better hearing was just always used as a marketing argument, and mainly it was used for the individual better entertainment. And but nowadays I see that, and I was totally surprised about the statements of Nicholas that in the United States it gets a little bit dynamic in that direction, and this is mainly consumer good driven and not hearing aid industry driven. So this brings some question marks to my mind. Especially, I was just thinking, okay, hearing is just so an individual thing for every one of us. And every individual is very selfish, you know, and maybe this is the reason why politics do not act in that way or for our global society, because hearing is such an individual thing, and solving an individual problem, yeah, always takes a backseat in politics, but not from the consumer good driven side, because they react to customer needs, you know, and the consumer side is even faster. So yeah, this was a cool insight from Nicholas, that this dynamic takes place in the United States. I don't see it actually in Europe at the moment. I don't know what Sarah's thinking about, or Claire, but you know, as in many fields, some dynamics will swap over to some other regions. Yeah, this is my point of view in that field, and I think it gets even more aware, but not driven by someone. Maybe it's driven by us as individuals.
Maybe this, taking this point of changes and disruptive events. If we look at the pandemic, I guess it has probably driven a lot of thinking around the topic of health and taking healthy choices. But at the same time, I think it has brought us to sitting in front of audio devices longer. I think the Netflix daily hours have increased from 2 to 3.5 hours. So this is a very disruptive event. How do we see that impacting hearing in the future? Please, who has thoughts, go ahead.
I was starting to think about, you know, who could forget, you know, we're in the middle of a pandemic, but in relation to the conversation we're having today, and I was thinking about the behavioural side of things, really, and maybe we'll come on to the impact in terms of increased headphone listening, because we're all, you know, on our devices a lot more, and I think there's evidence to indicate that's happening. But I think from a behavioural point of view, I think the world's got a little bit quieter for many. That's maybe in some ways raised awareness of people suffering from tinnitus. So we've had, particularly in the UK, a huge increase in people reaching out for support for their tinnitus. Now, whether that's stress-related aggravation of a condition, or whether the more quiet life we're living is making that more apparent. But, you know, talking about that relationship with sound and that emotional thing, you know, we're starting to listen to bird song rather than road traffic noise more, and appreciating the quiet. And I think there's some way to go in terms of encouraging people to have a healthier relationship with sound. We did a bit of kind of psychological look at this in a conference a couple of years ago, and you know, generally most people think of excitement and fun as being really loud, and you know being at a concert and everybody's being really noisy and we're all full of energy, and nobody, and if you think of quiet, you think of, you know, solace and you know, isolation, whereas quiet can be a really empowering space to be in, you know, to appreciate quiet sounds. So I think the pandemic has highlighted the noise in our life and the value of maybe not having too much noise. And again, thinking about face masks and the limitations that's put on our connection with people's faces. And people do lip read, whether it's because they have a hearing disability or a reduced function in their hearing, or just generally to be able to connect in background noise to a person's face. So we're talking about some of these issues that you never thought we would have been talking about, the value of lip reading and seeing somebody's mouth as they speak to us, because the pandemic has highlighted it. So yeah, we can talk about, the negative impact of increased hearing, but just thought I'd put a different kind of slant and perspective on what the pandemic has kind of raised in the area as well.
I really like the way of looking at this like an opportunity, because I think that also goes in the technology solutions that we're more and more relying on, say Zoom or Google Meet, whatever you use. They've increased the number of accessibility features in these tools because frankly, at the beginning of the pandemic, for someone who is deaf or hard of hearing, video calling was not a good solution, or there weren't enough good solutions out there. So it really has accelerated the pace of innovation in this space in a way that, I think without a global pandemic would have taken longer. So there's definitely an opportunity here to see. And that's also one of the things that we look at, like even if more people are exposing themselves more because they're constantly in Zoom calls or listening to Netflix, well, we now actually have a way of measuring that because we can monitor these devices, we can aggregate that data and then give people back insights about whether or not they might be potentially harming themselves, when before we didn't have as much insight into that. So it's an opportunity as well as a risk.
From the hearing aid perspective, we saw especially after lockdowns, that the interest in hearing aids did really rise, and everyone want to get a hearing aid. But I have to bring in some other aspect of the whole situation. And this is also a personal aspect. I have two kids, and one of them, my son, was in the situation of homeschooling, like anyone when there is a lockdown all over the world. And our flat is not that big, so he started to do his lessons mainly with headphones. And of course, he took the headphones we had at home and stuff like that. Now take the idea that listening to good and demanding sounds will improve your hearing, just as an idea. Yeah, like a good musician, he can say exactly this is a perfect tone. I know all the tones and all the sounds of the strings and stuff like that. So now my son is using for long time, not good equipment. So nobody knows if this will improve his hearing. I don't think so. My son listens through the COVID homeschooling to bad microphones, bad headphones, some people mumbling around, so he has to concentrate. So this gets even more energy is wasted of him. So I think the long-term aspect of the younger generation, this will be really, really interesting to focus on in, I don't know, in 2 years or something like that. Because homeschooling is not over yet. I think homeschooling will be a part of our lives for the next maybe years. I don't know, maybe for the rest of our life, because government and schools see that this could also be a part of, which I totally agree with Sarah. This is cool, and all the technology and stuff like that. But the question is, are we ready with the hearing technology and the hearing equipment to step into this digital process? This makes me a little bit think about, okay, maybe it is our turn to raise awareness on the technology side, to make even also some technology companies like Zoom, where we are having this webinar and stuff like that, to say, okay, don't forget this aspect of health.
And like touching on this, the hearing ability of your children, do you think that the products are currently equipped? Do you think that they are safe for your kids, and how are you dealing with that as a parent?
Philip, to be honest, I don't think so, that they are ready for the situation. So we started to talk with my son, and he tries to do the meetings sometimes without headphones and stuff like that, which is not, yeah, it is not better, but the sound is not that near, you know. So and he got also some other impressions and other noises by the surroundings, and we step one step back and stay silent in the meantime when he has his meetings. So the answer to your question, no, I don't think that technology overall is ready for that.
What would be maybe our ask towards technology companies, smartphone manufacturers, headphone manufacturers? Like, what should they do, or what can they improve? How can they help?
I think they should join Mimi for sure, because I think the point where, I mean, there is technology to solve this problem, but they don't seek it at the moment, you know. And maybe we can bring also a little bit awareness, not to the end consumer, also to this audience. And I think, like Sarah said, some years ago, everyone was asking, "Come on, what are you doing?" And explain it. And nowadays they say, check, got it. And maybe we're in a good way, you know. And maybe we just have to be patient and walk straight the way along we started.
Thoughts from the others on this?
I think this is actually a really interesting conversation, because from a technology standpoint, there's companies that focus on this and think about it, but then there's a lot of very dominant companies in the industry that don't think about it at all. And so I actually think that this is very similar to the same question we talked about from the consumer standpoint. The messengers have been wrong. And you know, if public health and governments are screaming at companies to do things, they're not going to care that much. But if other companies, startups, new companies, I know they're smaller at the time, but if they start integrating into those big players, and even if this is the big hearing aid companies out there who are relatively small to the major electronic companies like Samsung or you know, Philips was mentioned, or Apple or something like that, or HP, when they start to make those partnerships, which they are, I think they'll start caring more about this, and they'll start thinking harder about hearing from prevention side. But also, you know, I think we also just have to think about how simple it is to not simple, but how feasible it is to augment hearing and start to customize these approaches. And, you know, for Zoom, for example, it is possible for us to focus on speech frequencies and make them louder relative to other frequencies. And Zoom's a great case study. We're using Zoom right now, but quite frankly, like, I think a lot of people in hearing care should be angry at Zoom for trying to make captioning a cost barrier piece. I mean, that just shows how little these companies actually think about that. Zoom's primary means of communication is oral, and they were literally putting up barriers for people with hearing loss. So, you know, it's up to industry to help industry, if that makes sense. They have to be the right messenger, in my opinion.
I think that's a really, really great point. Oh, sorry, Claire, I didn't mean to interrupt.
No,
I just think it's a really great point. Like, you know, we all sit around nodding our heads when we talk about statistics about how many people at some point in their life will experience difficulties with hearing loss. It's a massive, massive number. And yet the people designing the products that could actually help those people tend to have this bias where it's not generally people who are from the hearing impaired or hard of hearing community designing these products. And so it's an afterthought. And I think what companies can really do better is actually take a look at the statistics, see that they're missing out on a massive market, that there's a huge need for these tools, and incorporate that into the everyday process that they use to design products. Because it's not a niche issue. It's not a, you know, backdoor, very small disability. It's something that everybody suffers from. So it has to be front and center.
Yeah, I was just going to say, but in terms of being consumer driven, I think we need to drive the consumers to realize their need. So in terms of the school scenario, parents can be really powerful. If they say to their school, my child is suffering because they have to be on these Zoom Teams calls all day and they're listening, and I've found that their listening levels are too loud for their hearing health, and I want you to do something about it because you're the school and you're the teachers. So the teachers start saying to the local government, what are we going to do? I've got parents shouting at me. It's a little bit like the kind of healthy eating in school. You know, you get the parents saying, I'm not paying for these school dinners because they're rubbish and they're not nutritionally good for my child. The schools start getting nervous and start looking for alternatives. So it's kind of, you know, come into the market with innovation. I think, you know, the innovation is starting to come through now, which excites me because there hasn't been innovation in this area for a long time, but we've got to drive the consumers to realize their need for this innovation, and having that, you know, that awareness about, you know, this isn't so good for my child. They are, you know, listening to headsets all day at school, and then in the evening they have 2 or 3 hours on their gaming machine or listening to music or whatever. So you're spending 12 hours a day possibly, you know, with very close listening habits. And we need to, you know, we need people to understand that's a health issue for a start, and then to know that there is innovation and technology that can help them monitor that and have like we've talked about very early on, that safe relationship with sound, because we don't want a quiet world. We don't want to live in silence and solitude, but we need to understand what healthy looks like, and enabling people to say, I've had enough, or I'm going to turn it down so I can listen for longer, and have good quality listening experiences, which all add to, you know, making sure we don't harm our hearing health.
I think if it's okay, if I just jump in, I think we should also highlight something Sarah said, that you sort of mentioned it quickly, and then we're thinking about this from the angle of hearing and hearing health and hearing loss. But most of these basic interventions that we're talking about, you know, not so much on the prevention side, that truly is hearing loss, but on the augmentation side, everybody benefits from this. You don't have to have hearing loss to benefit from improved sound quality. You don't have to have hearing loss. And we're sort of saying this, but let's just make it clear. This is like a societal, everybody benefits thing. And sometimes the framing, again, when we only put it on the hearing loss side, we sort of miss that. You know, I'm not like ashamed to say I use captions on my TV every single day and on my computer every single day. It's how I function. And I don't have a measurable hearing loss. So these are good things for everybody, you know. And I think when we make that message to people, I think it starts to remove some of that stigma out there. You know, when we mitigate things and push people to the side saying like, you need extra help because of hearing loss, that's a different message than augmenting sound is good for everybody's communication.
That's such a good point. I think it's super interesting, like, especially what Markus was saying too, with, you know, children being fatigued after being on Zoom all day. Part of that is increased listening effort. And it's not just intelligibility that we're talking about. We're talking about really fatiguing ourselves, putting ourselves in suboptimal sonic situations. And definitely that's, yeah, I think that's an excellent point.
Yeah, and I think what was interesting here as well is this, I think for children, but I also see it with my father, like it should be something that they want to have and not something that their parents tells them and that they need because they're otherwise not able. So like, how do we get it to something desirable instead of something that you need? And
I guess that's something we have to figure out, Philip.
If the game is glitching, I can tell you a teenager is not happy. So if we can give them a good sound experience and they can tell the difference, they will know the difference. You know, they will say, that's what I want. Because they want, you know, my son wants good headsets. He wants the most expensive ones. He doesn't always get them, but he always wants the most expensive things because he knows the difference.
I think there are already some questions coming from the audience. I think Lucas will moderate or we will send some questions that we then want to answer from the audience. Before we start with that, maybe we finish with one question, like how are you seeing then the future of hearing health? Maybe as a closing round, and then we go into the Q&A and let the audience in.
I can start if nobody's brave enough. No, I mean, I think we've touched on a lot of things, so I won't go super long. I think we all recognize what a massive problem it is. We think technology can be part of the solution. We are starting to see changes, but it's not enough. And I think over the next 30 years, the problem will only grow. And so it's a real challenge and a real call to action for all of us to continue to push, find the right way to deliver the message we're trying to deliver. And I'm personally quite optimistic. I've seen enough change in the past years to make me believe that the technology will continue to get better and we will continue to be able to meet the challenge of this global health crisis.
I continue. I'm also optimistic. Generally, I'm an optimistic person, but I think one thing we need is a little bit patience, I guess. And when I look into this round and all the good answers, I think there's a good seeding ground for better hearings. So just keep this ground safe and let the plants grow, I guess.
Good words.
Yeah, I'll leave Nicholas with the last word then. So, you know, I'm a very optimistic person, but I do, you know, I've worked in health and safety for many years, and safety, that acute accident was always very dominant in people's minds. People now are much more aware of the health side, the longer term, the chronic, the slow accidents happening to people, and young people. You know, our young people now are much more sensitive to their health. They're much more engaged in their healthcare and their health status, and that's where the opportunity is. I don't think we've won the battle on getting hearing health up there with other kind of health concerns, but the fact that people will be open to know and understand if we get the messaging right, do a bit of advertising, a bit of promoting, a bit of marketing around this area to get the messages right so that they make that difference. Yeah, I'm optimistic that we can make the difference and get people engaged and the right people in that. And I think that all goes down to the younger generations taking this and teaching everybody else why it's so important.
Yeah, I'll ditto what everyone is saying and repeat sort of, but I mean, overall, I just see, I'm quite optimistic because I see hearing care going from an acute medical care model where we treat it as a one-time sort of event in the healthcare system to a chronic condition with consumer-based solutions that are a part of your everyday life, which is what hearing loss actually is. It's not something that you treat one time in the office and just deal with. It's something that evolves over time, your needs evolve over time. And moving towards that is incredibly important and incredibly powerful. And by consumer-based companies, technology companies getting involved, the end user is now aligned as the important person. And that is a big difference between having a middleman in the healthcare system. And I think this is incredibly important. And I think it actually speaks volumes to we're going to see crazy advances very soon. You know, hearing care has not always been for people with mild loss, for example. We haven't thought about their needs. And now they're the end user of these products, and the R&D companies are focusing on that. And that realignment, it just, I'm very excited to see what happens. You know, I know a lot of people in audiology are sometimes worried, and sometimes they think they're being cut out of the picture, but I think there's room for everybody in this. This is a really, really big area. And quite frankly, the healthcare system can't do it without partnering with the rest of the consumer-based technology companies.
I really like this point of it's not patients anymore, it's empowered users that do what's right for them. I really like that point. Really, really good closing round. Let's have a look at what questions are coming in here. So Lucas is aggregating them for me. So that's the first one here. What can be done to help people who wear headphones as part of their job? What can be done with the extra hardware, and what can be sorted by apps?
I can make it take a stab at this from the Mimi side. It's definitely a huge area of research focus for us right now, is looking at how can we provide people with a better sonic experience where you have lower listening effort, increased intelligibility, but you're still automatically reducing your exposure. And so for people for their job who need to, say, work in a call center and are constantly wearing headphones, we can create some kind of custom processing for those users so that they can over time reduce their dose and still be able to experience high quality sound.
Any additions? And if the question was not answered, then post again.
I guess just again, we're talking a little bit about different audiences. So I think, the users need to understand that there's a health concern related to listening with headphones. A lot of people wouldn't even acknowledge that there was an issue that could impact their health or fatigue them, as we mentioned. Employers need to know that they have legal obligations often in this area. Again, a lot of employers will not realize that if they're asking people to listen on headphones all day, that there's a potential legal duty of care in that area. So I think, looking at the different audiences and then, looking for the solutions to help kind of get the messages across to those kind of duty holders within those scenarios is important as well.
I think this is a very nice segue to the next question. Should governments begin to create legislation in the consumer market as they do for workspace noise to limit sound exposure, to push technology companies to evolve? I think it touches very much on your answer here.
Yeah, and again, I think I was the one who brought up the legal duties, but often legislation doesn't, we have rules, we have marketing legislation about noise emission levels and having to report them, but does anybody ever look at them? I think that consumer driven want to look at that data, to understand that data, is important, as well as the side of having rules and regulations. So I think the two have to marry together. I think we can have laws and rules that suppliers have to abide by, but we need the consumer market to want to look at what the difference is, so they then have a choice in what they buy. So I hope that touches on that a little bit.
Any additions? Then I would move to the next one. Considering we have 1 billion people plus having hearing loss in 2050, will there just be a lot more hearing aid stores, as personal care is still very important when getting a readjusted hearing aids?
I think Dr. Reed touched on this a bit, but I feel like because the problem is so massive, we will see myriad solutions. So increasingly, as we see players like Bose getting into these consumer-facing products, you'll probably see more hearing aids, but you'll see more consumer-centric devices, and I think more situational products that are available to people. I talked with a woman who had hearing loss a few years ago, and she showed me the kit of things that she would bring to meetings to be able to understand properly. So she had a pen mic she'd put in the middle so that she could get the background conversation of the table. She had several other portable microphones that she would place around the room so she could properly understand all of the conversations. And for somebody who is just trying to move through daily life, this kind of solution is untenable. So we'll start to see things that really address the specific situations where people are struggling. And I think we'll see expansion across all the different technological solutions that are available.
And that number is not inevitable. We have an opportunity to intervene, to not have that huge number of people affected in terms of disability. So although, yeah, we could sit back and go, gosh, this is going to be a huge costly problem for us in 25 years time, or we can say, hey, this is enough, this is not acceptable, most of this is going to be preventable, what can we do about it? So the opportunity is there to start now, to make sure we're not dealing with those kind of problems in the future.
Yeah, I honestly think this also just drives the way we change sort of hearing care in the clinical side in general, right? So the consumer companies are getting involved. There's more self-fitting, there's more self-advocacy, there's more sort of self-driven, which changes people's behaviors as well. But this also changes the way the healthcare system is going to work. And I think you're already seeing this with the major hearing aid companies introducing very user-friendly apps that allow you to make those changes, contact your audiologist very quickly, and make those quick connections that, again, moving from the idea of a clinic-based medical model to that chronic condition full lifestyle model is a big change. And I think people will be very satisfied with that change, to be honest with you.
Good. The next question is very long. So I think we will share the contacts of the panelists, and the recording I think will also be shared by Lucas. And let me read here. Yeah, what about pharma companies treating hearing loss? Will we see a cure for noise-induced hearing loss soon?
So I don't follow this extremely closely, but obviously I follow the literature, and I think 5 years ago we would have scoffed at the idea that that was on the horizon, but the truth is the work from Frequency Therapeutics, the results of their clinical trials that are coming out, which are still in early phases, they're real and they're promising. And I do think that we'll see pharmacologic interventions, whether those will work for everybody, whether that is only for noise-induced versus general age-related necrosis of the cells. These are different questions. I don't think it's a panacea. I don't think we're gonna flip this switch and solve everything with pharmacologic interventions. Not for many decades, to be honest with you, if that does end up being a pill issue, or an actual solution. But I do think in the future, the near future, the relatively near future, we will see a pharmacologic intervention for hearing loss that has efficacy and is effective. And that, again, is another layer in this. And it's not going to solve all of our problems, but it definitely will help some people.
It sounds promising.
I think it's that you were saying about, it's not necessarily going to be a panacea. And I think this is the point to make, is it's like saying, we talked about before about the stigma and, well, I'll just get a hearing aid when I get older because, that when I'm old, I won't care. So I'll just grab a hearing aid. But, we know hearing aids don't replace our very delicate hearing function. So they turn all the sound up, generally. So, again, a pill might, in some way replace some loss of function. But again, it's teaching people of the value of the delicate sense organ that we have, and how skilled it is for conversation, for music, and protecting it in the first instance, rather than thinking, hey, in 10 years time I might get a pill, so I'll worry about it then. So yeah, I'm sure we'll have a multitude of new solutions and treatments for this health condition and the variability of the health condition. Somebody there is talking about tinnitus. You can have a hearing loss and tinnitus. How do you deal with that? You can't fix one without maybe exacerbating the other. So yeah, we'll have loads more solutions, but let's protect the delicacy of what we have, and appreciate what we have.
This is the thing I also want to add. Thanks, Claire, for this. I think that a pill always solves a problem. And so we wait for the problem, then there's something solving it. This takes away our personal responsibility for our health. So I'm not that happy with that thing, but as Nicola said, it really might help some people.
Maybe last one, and then we, I think, need to wrap up. How do we overcome the loss of sound quality for people with hearing loss between platforms?
Sorry, can you repeat that one more time?
How do we overcome the loss of sound quality for people with hearing loss between platforms?
I'm not sure I entirely understand the question, like having a platform agnostic way of moderating call quality or like audio quality, or?
I think platforms and technologies like Zoom and Netflix, I get as an amendment to the question here.
Got it. I know there is some work going into this already on the side of companies like Spotify and Netflix. And right now, I don't think it has this angle of, say, hearing impairment or helping people who have difficulties with hearing, but they take the angle of, we want to normalize loudness across different songs on Spotify, for example, because, we know loudness is this subjective measure, and a classical piece versus a, rock piece, even if they have the same absolute energy level, the loudness is going to be perceived differently, and then can be very jarring when you're going from content piece to content piece. And so they're already doing some work to come up with a perceptual measure that allows loudness to be normalized across these different content types. And potentially, if we look at this from the hearing impairment angle, there's another standard that we could implement that would require different platforms to have audio quality standards, or implement codecs that help people with hearing impairment, or whatever it is. We could potentially look at that from that angle as well, having a quality standard or some type of I guess standard that all the platforms have to comply with in terms of audio quality.
I think then we are reaching the hour, and I think I really like the closing round before that tunes me very optimistically, and I am looking forward to continue the conversation with this round, but also with the audience. So please join us on this mission. Let's make it a really successful World Hearing Day and World Hearing Week with us, and yeah, let's continue this and make it a movement. With that, thank you so much for taking the time to participate and listen. Really, really grateful.
And thank you very much, Markus, Clare, and Dr. Reed. It was really interesting to hear your perspective. Really appreciate your participation.
Thanks for having me.
Thanks to you guys. Bye.
Thank you. Bye-bye.